Any other questions? Yeah?
I thought when I read the advertisement for this, that it mentioned the animals. Would your
Yeah.
calming product up there have any effect on a small dog that gets very upset when it's going to storm?
So in theory, yes. I can't tell you for sure, but we use these with animals. We use this with children, babies. You can use these. They're safe to use with people of all ages. So dogs have been. You can use them with dogs, and the Tranq one is designed to relieve anxiety and reduce stress. So I would try it for sure.
Would you have to do it an hour ahead of a preceding storm, or could you do it right at the point when it's happening?
I would use it in advance if you know it's coming, so that the dog's in a lower state of anxiety to begin with. But you could use it at the same time too. I do both, just as a caution.
I had a question about the fungus that you had mentioned. In treating it, you said with aging, is that playing a role with inflammatory processing? Or something?
Sure. And
how
you
would
see
treat
bone
it?
changes in people, you know it's infecting the bone. I treat the infection in the bone to treat arthritis, to treat bunions.
And that's fungus related?
Yeah.
Candida fungus?
It could be a different kind of fungus. Candida is definitely an internal infector, but it can be different forms of fungus.
So you will be coming out with something like that?
Maybe someday. I would love to, but I'm a little concerned about how intense that's going to be for people.
But the detox right now, those work a bit on fungus?
Yeah, so some of these are going to treat infections of various kinds in various places. Like the sinus one, it could be a fungal infection in the sinuses. It could be bacterial infection. It will attack infections as pathogens, and it will address that. So yeah, very specifically, like the fertile essence one will treat fungal infections in the reproductive organs. And so instead of coming out with something that would just treat all fungus and make people ill for 3 days to a week, I will have something that will be very specific that won't make people ill at all, like dealing with sinuses.
So aches, for instance,
Uh-huh.
aches and acute are treating differently because acute is moving things, would you describe it as
Yeah.
more rapidly?
More
faster?
inflammation, yeah, more swelling and inflammation, broken bones, dealing with it as an immediate kind of injury, wounds, to heal the wounds. But I did not, so aches, treating fungus would have been a fantastic thing to do for aches, but I chose not to do that because a lot of aches are fungal infections in the bones, but I chose, because of the intensity of the die-off, not to do that. So of all my products that would be ones that might not cure the problem and be used more symptomatically, unfortunately aches, because it's not going to deal with an infection in the bones, might be more symptomatic for some people.
So practitioner lines versus store lines. Right now, as I understand it, your practice is on a waiting list. You hope to have openings in the fall. But if any of us wanted a personalized treatment, you said, for instance, couldn't use sunflower oil, say I want a personalized treatment for fungus.
Mhm.
Are you still open to that as a practitioner and a Fuji-Wen provider through your Chi Infusions?
Thank you for asking. On my website at chiinfusions.com, you can buy a customized infusion where you can receive that. It's more expensive because it requires a lot more of my time and energy, but yeah, you definitely could do that if you wanted to. But you know what you're getting into now that we've had this conversation. So. Yes?
Yeah, I was concerned about studies, like pharmaceuticals having trials and clinical studies. Is there anything?
Yeah, so at this point, no. This product is brand new, essentially, and this medicine is new. And I'm a poor clinician as opposed to a corporation that has the resources to do that. But I certainly hope to do that. And in my mind, I'm thinking of ways that I can kind of sneakily do stuff like that, like asking people at eye centers, giving them free product as blind studies and letting them, because they have access to the equipment to do everything. So I'm thinking about it, but at this moment, no. I should know that.
The aches, for instance, not to take away from the time that you'll have to ask a question, but I do have to share this. I've been using aches for almost 4 weeks now. After the first 2 weeks, and it's not just the aches because I've been wonderfully treated by you also in your practice, 3 treatments for the aches. I don't have to use my glucosamine sulfite anymore, I don't have to use my MSM anymore, and I don't have to use my internal hyaluronic acid anymore in order to get through my 10-hour days. And just like not giving up medicines rapidly, I'm not suggesting that anyone start and just discard supplements that they've been on for a long time. But if you had told me a year ago, after a dependency on the glucosamine sulfate, the hyaluronic acid, and the MSM for years and years and years in order to get through a day without more than aches, I made a great advancement with digesting fibrin in my blood with nattokinase and serratiopeptase enzymes this year and was able to get out of my special shoes. And now I thought, there can't be any more blessings coming to me with my torn ACLs and my bone on bone and my arthritic joints. And even these chi infusions have been the greatest advancement that I've been able to make without putting things internally into my body.
Right.
They're just rubbing the drops on my skin 3 times a day. It's wonderful.
That's great. Now I'm going to take 2 more questions, and we'll go to this, and then we'll have time at the end. So I think you two both have your hands up.
One of the things that I hear from doctors that I visit is that as you get older, you have a tendency towards diabetes. Is there something in your...
I've been working on trying to solve diabetes forever, and I think I'm onto it now. But there's no I haven't yet found the Western corollary to it. It would be something in Chinese medicine that there's certain organs that have other energy beneath it that is supposed to keep it at the right temperature. So the uterus, for instance, has these angles that keep it at the right temperature. So so specifically glands seem to have this process where the gland is above it and then this energy beneath it is supposed to keep it at the right temperature. And what I'm discovering with diabetes, for the pancreas and the pituitary gland especially, and sometimes the thyroid gland, that it's too hot underneath. It's like the embers are too hot, the fire's too hot, and therefore the pancreas is overactive. So I'm really on the, I hope, on the edge of figuring that one out. But that has been a tough one to solve. And if I can't solve it, I tell people that I feel it's important to understand
The
that.
baby boomers are coming.
Yeah. I want to solve it so bad.
Do you think genetics play a role in like preventative with these? For example, macular degeneration is supposed to be genetic, and you mentioned something for the eyes. I take
She's
something
asking
that-
about genetics for the group back here that
Yeah,
can't
so-
hear this wonderful custom.
So are there
Genetics, well, let's go back to these layers of energy. You get to a certain layer, and you're talking about genes. And you can get further beneath it, and you can get closer to the surface from it. So most people have genetic issues, not all the case, but many people develop them later on in life. And that's because an imbalance has developed that has led that gene to be active, from my perspective. So if you can turn that imbalance off, the genetic component, so my perspective on it, anything that can come on in time can be turned off in time.
So don't do preventative? I'm sorry.
But you were asking about specifically if any of these have a genetic...
Macular degeneration for your eye.
I have not specifically thought about it from that perspective, but I thought about it from different energetic levels.
Okay.
So I can't say that we treat that specifically, but I believe that it's likely that we're dealing with the deeper imbalance that would be turning a gene on.
Okay.
That's my perspective, and there's no data, scientific data to prove that that's true. All right, so I'm just going to take a moment to talk about all these products, the specific ones and what they do, and then when I'm done, we can have some more questions and answers, and I thank you for your time. So you'll notice that on every box there's these little symbols on them, and the reason for that is one day I expect to have hundreds of these treatments, just like I have with spirit branch medicine. And so I want a way to classify them pretty quickly and easily. So, M is for musculoskeletal. So if you have a problem with musculoskeletal, you just go to the M group and be like, oh, aches. So the problem with aches and pains is that they can be incredibly complicated. There could be 10 possible causes of an ache or pain. It's actually one of the hardest things to treat in an acupuncture clinic, surprisingly. Although people come to me all the time and I help them with their aches, because aches can be infections, aches can be problems with the nerves, misshapen nerves, infected nerves, problems with blood vessels, infected nerves, inflammation in the blood vessels, infected blood vessels. Can be soft tissue problems, could be bone problems, broken bones, inflammation of bones. So it's just a huge mess when someone comes in and says, you know, I have pain here. Well, I'm like, okay, we're going to figure this out, but it might take time. This is my scatter shot approach. And the reality is that there's no one treatment that's going to be able to solve every person's aches and pains because it's so complicated. So what I did here is treating inflammation, treating swelling, treating bones, treating soft tissues. So I try to, you know, hit them all. But like I said earlier, what I'm not treating is specific kinds of infections of a fungal nature because of the die-off process, and that tends to be a very common cause of pain. So for those specific circumstances, this would be more symptomatic relief because it would deal with the inflammation part of it, it would deal with the swelling part of it, but it wouldn't necessarily deal with the root. I try to always deal with the root when I can, so this is kind of the one exception to that. But it's still a fantastic, as Marusha said, it's a fantastic treatment for dealing with pain. Acute injuries, Marusha mentioned this one also. This one is for everything from bumps to surgery. So it's to deal with the immediate impact of an injury. To deal with, the quicker you deal with inflammation and swelling, the less you ultimately have. That's my experience, and I mentioned Arnica montana, that forever was my tool of choice. Arnica montana, in my experience, goes to the surface level of the muscles in terms of dealing with aches and pains. And this is going to treat not just that level, but any tissue that might have inflammation and swelling. And so I still think Arnica is a fantastic tool, don't get me wrong, but this I think is a great method of dealing with the same issue.
So do you use that for your kids now?
I do, yeah. So I just want to talk a second. I realized that I didn't mention why I came out with these products specifically. When I was, like with the spirit branch medicine and Fushi-Wen, I could treat anything really with this medicine. But I had to limit myself somehow, because with retail products, you can't just come out with the entire case of homeopathic products that is out there and say, you know, figure out what to do with this. So I decided to come out with just a small set first. And I wanted to come out with something that either would be so unique that there's nothing else like that on the market. Ghosts, for instance, we're going to talk about that one. I wanted to come out with something that I thought was superior to other products on the market because I had something new to bring to it, like colds. Yeah, or flus even, where you can take oscillococcinum is a great tool for it, but this is a totally different way of dealing with it that I think is better, and I'll describe that in a second. So I wanted it to either be an improvement on something in the market, something that the market has never seen before, or the last thing was something that I thought I could add to that might save people's lives, that I felt ethically obligated to come out with, even if it was a bad idea. And we're going to talk about New Chance, and that one is kind of falls within the I have to be very careful what I say about it kind of category. All right, so I'm just going to go through the musculoskeletal ones, last one.